Hi, my name is Josie. This is my model, Allison. And for the manual therapy techniques that I have chosen, the first two I am going to do are a CT junction manip and a thoracic manipulation. The reason I'm choosing these is obviously through my assessment that there was hypomobility and that we could address this through manipulation. I obviously would have screened to make sure manipulation is appropriate for this patient. Um, the reason I think CT junction and thoracic are critical to have mobility is especially with a golfer with his extension, his rotation of his thoracic spine, and also movement of his head as he's finishing his follow through and looking to make sure he has the right mechanics and be able to keep stabilized while the thoracic is moving is super important. So I'm going to treat that, do manipulation, get some more movement. Allison, so obviously, as we assessed, I found some tightness at your CT junction, which is where your cervical meets your thoracic. It's a little bit tight there, and I can do a technique to get some movement, and as well as in your thoracic was also pretty tight, which are both critical for a golf swing. And so with these quick movements and manipulations, what we call them, you'll get some a little bit more mobility, and we'll do some exercises to keep that mobility. Okay? All right, so go ahead and sit back here. All right. Can you look up for me? Okay, awesome. All right, can you put your one hand behind your head? Good. I'm gonna come up under here. All right, put your hand on top of mine and put your other hand on top of yours. I'm gonna come here. Okay. How are you doing here? Good. Good. All right, I'm just giving you a little squeeze here. I want you to squeeze down on me. Yes, good. Can you look up? You okay here? Yeah. Okay, you okay if I add a little pull here? Okay. How does that feel? Good. Good. Okay. So this was a CT junction minute, and now I'm going to do the thoracic while we're here. Okay, so this is the level where I found that you were extra tight. So I'm going to put this right here. Come up against it. Okay, can you cross your arms for me? Good. You squeeze here. And you back. You okay here? Mm-hmm. Okay, are you okay if I add a little bit